computer. Okay, friend, we are recording Mr. Tyler Yates, and thank you so much. We had a chance to catch up just for a moment before I hit the record button, and you were back by popular demand. We did this interview some time ago for this drug policy course, and it was always a big hit, sort of a fan favorite. Really nice to speak to somebody that's working in the state, for the state, around policies that include drug issues. And I know your fingers don't touch all the various drug policies, but they touch quite a few. I wonder if you could introduce yourself by way of anything you want to say about how you got to where you are and where are you and what are you doing?
Yeah, absolutely. And thanks for having me again. Really excited to have this conversation. I really enjoy talking about drugs. I really enjoy talking about drug policies. So really excited for this. So I am, as you mentioned, Tyler Yates. I am the state opioid coordinator with the Division of Mental Health, Developmental Disabilities, and Substance Use Services at DHHS. Only been in this role for about 6 months now. Prior to this role, I worked over at the Division of Public Health as the Overdose Prevention Initiatives Coordinator, working primarily in the harm reduction space. How did I get here? It's a great question. Not really sure. No, but in all seriousness, my journey really started with my own experience with substance use as a former drug user. It just kind of led me down this path. I went to school, got my certification to become an alcohol and drug counselor, was a peer support specialist, worked for a community-based organization in Greensboro for several years at a syringe service program. And then this position or the position I was in at Division of Public Health became available and a bureaucrat hating guy like myself wanted to give it a shot and here I am almost 5 years later. So I've really enjoyed it. It's really an honor to be able to work for the state and alongside so many awesome people.
Thank you, Tyler. And we'll go ahead and do a shout out to GC Stop, that the agency you mentioned here in Greensboro, which is my hometown right now as well. They do such great work, and you did for them. And now moving on to broader macro issues and maybe making a broader impact. Of course, I did see you not long ago, even though you were, down in Raleigh, you found a way to get by GC Stop and go by one of the distribution sites and kind of hang out for a while. So that was a real treat seeing you there.
Yeah, it was great to see you there. It's really hard to stay away. I'm a social worker by training, got my bachelor's in social work from UNCG, and my really everything that I've learned about substance use and people who use drugs and just the needs of the communities that people are in has come from that direct service or my lived experience and
Mhm.
I'm really grateful for being able to work at a community level, being able to work with really amazing people. I say it all the time that drug users are they're the best people I know. It's just so great to be able to work with so many awesome people.
Yeah, Louise, who you know in Greensboro, she once said to me that people feel that sometimes have a sense that drug users don't have any feelings. And she said it's quite the opposite. They feel too much, which is a
Yeah,
pretty powerful statement.
very
Um,
powerful.
yeah, yeah. Uh, we kicked around some ideas of which policies. Ultimately, I took the energy efficient route, meaning the lazy route, and said whatever you want to talk about. So, we got some things on a bit of a checklist. But Tyler, we're looking at just very brief commentary on some of the issues that you find perhaps even more pressing or of particular interest to the students. So if I can, I'll just toss it over to you and pick one and pick a second, pick a third, and we'll just go for I don't know, 10 minutes or something.
Okay, cool. Yeah, we can try to do that. I guess I can start with just kind of a little bit of background about what I do in my current role, because that kind of leads into it. So my current role, my primary job is to coordinate efforts among state agencies to ensure that we're carrying out the North Carolina Opioid and Substance Use Action Plan. So the action plan was developed in 2017. It has been updated a couple of times since then. But it really focuses on three priorities, which is preventing future addiction. So, really, that primary prevention and trauma informed approach to keep people from, I guess, reaching chaotic substance use. We know that, science shows us that the later that we can delay use till, so like the earlier somebody starts to use drugs, the more likely they're gonna be to develop a substance use disorder and maybe have some challenges with their substance use. So that first priority of preventing future addiction really focuses on that, and provider and doctor education. We know that um, early on, so we saw this rise in overdoses starting in the late 90s, early 2000s. And a lot of it had to do with the way that pain pills were being prescribed and marketed at the time. Over the years, we saw that steady increase, and then we started to see restrictions on prescribing where, doctors were cutting people off completely or restricting how much they could receive each month. And people were still sick, people were still in pain, and they were kind of forced into the illicit supply where they were getting heroin off of the streets. And overdoses continued to rise. Then we saw the introduction of fentanyl to the drug supply, which just really made those overdoses skyrocket. So that that primary prevention looks at like training doctors on proper and evidence-based ways to use opioids or other pain management means for treatment or the treatment of opioid use disorder. The other priority is harm reduction and reducing harm associated with drug use. So, supporting syringe service programs, getting naloxone out into the communities, um, really all of those strategies that we know mitigate risk, like, overdose prevention, essentially. So, education, teaching people ways that they can use in a safer manner and hopefully mitigate some of the risks that come with drug use. And then the third,
Tyler, real quick, let me jump in. Could you give two or three, you gave one, I guess, but two or three examples of what may be some harm reduction tactics people might use?
yeah, absolutely. So some of the tactics that are used, I mean, syringe service programs are one of the main mechanisms of getting that harm reduction word out. So they provide people with sterile supplies that prevent the spread of disease like HIV, hepatitis, other illnesses that maybe are associated with IV drug use. It also reduces their chances of getting things like endocarditis, which is a really serious heart valve infection. Harm reduction focused programs like SSPs also do a lot of education. So they're teaching people, maybe one of the big ones is don't use alone, never use alone. And that's because it doesn't matter how much Narcan or naloxone I have on me. If I'm by myself and I overdose, I'm not going to be able to use it on myself. And then the third one that really comes to mind is just the linkage to care that SSPs provide. So syringe service programs provide testing for things like STIs, Hep C. They also provide linkage to care to vital resources like substance use treatment. Some of the SSPs in the state even provide child care and like just wraparound services. So when you think about the continuum of substance use services, we have syringe service programs that are doing everything from that primary prevention, where they're working with families to prevent, kids from starting that use and working with families to prevent like future addiction, all the way to recovery services and anything in between they're providing, which I think is really cool.
Thank you.
So
Thank you. Yeah.
those are
Yeah.
some of the
Tip of
things
the
that
iceberg, but those are
yeah,
key ones.
just tip of
Yeah.
the iceberg. There's way too much to go into.
Yeah.
We don't have enough time to touch on everything. But then the third priority of the action plan is connecting to care, which I kind of talked about. And that really encompasses anybody and everybody who's connecting people to or linking people to services that they need. It really focuses on connecting people with evidence-based treatment. So things like medications for opioid use disorder, methadone, buprenorphine, or also known as Suboxone. Naltrexone, which we know is not as effective as methadone or buprenorphine, but it's still there is some evidence basis behind it. Linking justice involved populations to care is really important. That's one of the strategies because research from North Carolina, from UNC, shows that people that are leaving the prison system in North Carolina are 50 times more likely to die in the first 14 days after they're released than the general population. And that's because when they're incarcerated, their tolerance drops. And, when they get out, if are not connected to the proper services, they may be at higher chance of returning to use and then are at higher risk of overdose when they do return to use. So that's just kind of a very high level overview
Mhm.
of what the state action plan is and some of the strategies and priorities that we're working on at the state and that we're really supportive of.
And it's all public access and it has a lot of data there. It has a dashboard. People can click through there and really be kept up to date. I know at the time in 2017, I think it was kind of renowned across the country for being progressive. So it's a great tool.
Yeah, absolutely. I say it all the time, even though I truly feel we have a very long ways to go in North Carolina as it relates to drug policy, we are so far ahead of other states. I mean, we have folks from different states all over the country reaching out to our division and our Department of Health and Human Services asking how
Mm.
we're doing this, how are we making it work, and I think that just really goes to show how much work and effort has been put in by the state.
Yeah, yeah. So true. Okay. Well, thank you.
Yeah.
Do you want me to prompt or do you want to jump
Yeah.
into a couple that come to your mind?
I guess if maybe you have a prompt or a specific question, that could be
Sure.
really
Let's go down to some real basics and really
yeah.
away from my list. I'm just drafting off of some of the things that that your group is mission to do. So let's start here. I'm using heroin with a friend and they're overdosing. What are the legal ramifications? What's the drug policy about me calling in my friend? Am I going to get busted? Are they going to get busted? Why don't we start there?
Yeah, so it's that's a really great question and something that has evolved over the years. So we know North Carolina does have a good Samaritan law. So if you and I are together and one of us overdoses, and if I overdose and you call 911 and provide them with the information that hey, this person's overdosing, this is who they are, this is your name, like you have to provide your name when law enforcement comes, you're protected for possession of drugs up to, I believe it's 4 grams. That may have changed recently. Maybe it's 3 grams. I'll
Three
have to go.
3 grams of opioid related. Is that?
No, so it now touches on all drugs. So
Oh,
it
okay.
it was expanded to include other drugs. And actually I think it may be a gram. It was just opioids up to a gram. They changed it and it was revised to be any substance that's scheduled up to a gram.
Mhm.
And then anything over 3 grams of opioids specifically is considered trafficking, which is a whole nother thing. But so if you provide that information and law enforcement comes, you're protected up to a gram of possession of drugs.
Now, still
Uh,
responsible for any ancillary crimes that may be maybe I'm committing during that time, but for the drug possession up to that level, I'm protected. So I can call in 911 to help save someone's life. That's the
Yep. Absolutely. And one interesting fact that isn't talked about as often, but was really a driving force behind that law is alcohol use and underage drinking. So if you're under the age of 21 and you're drinking alcohol or under the influence and you call something in, whether it be for, alcohol poisoning or another type of overdose, it also covers underage drinking as well.
Good to know. Good to know. Thank you. Um, Now, how about if I'm not calling the police, but the police um, are are addressing me, and they ask to search? Is there some kind of protection if I let them know ahead of time that, hey, I've got a needle on me? It was something to protect the police officers at one time, I think. Am I barking up the right tree there?
Yeah, absolutely. So there is the tell the officer law. So if I get pulled over and an officer asks to search me and I inform them that I have sharp objects like a syringe in my pocket, I'm not supposed to be charged with possession of that paraphernalia. However, sometimes that still happens, and another way to get protection is to receive supplies from a syringe service program. So if I'm going to a syringe service program, they'll give me a card that says I am a participant of this program, and under North Carolina General Statute 9113.27, I'm supposed to be protected uh, by law for possession of that paraphernalia.
Mm, mm.
However, that is something that, many communities still struggle with. I can tell you personal stories of participants that I've worked with and conversations that I've had with law enforcement officers where participant ID cards are being ripped up and thrown away or told that they're fake or that they don't, that card doesn't work here, and people are still being arrested and charged with paraphernalia or even felonies because the law does also the syringe service law does protect against residue in the
Mm,
paraphernalia as well.
mm,
However, oftentimes they will be charged with a felony for a little bit of residue that's in the syringe on top of the paraphernalia. And then what happens is, you go to court, even though you're a legal participant of a program, it's, plead guilty to the paraphernalia that you were supposed to have and we'll drop the felony or take it to trial, which we know how that can end up. So
mm, mhm.
there's still a lot of challenges and a long ways to go with SSP laws.
And that's what I've heard as well. And it's almost like by county. Some counties are just on board and they're seeing this as a part of a larger picture of around health in the community, and they're on board. And others are a little bit more of the we're going to catch you doing wrong and lock you up. So
Yeah,
yeah, yeah.
absolutely.
And there was a time, and I lost track. There was a time when someone was trying to pass a law that the paraphernalia you had, syringes specifically, had to have the name of the agency that was on it, so it got back to the right agency, et cetera, et cetera, et cetera. It was doomed to fail, but where did that ever wind up falling?
That did not work out. And
Didn't
that
pass.
Yeah, it did not pass. That would have crumpled our public health system for drug user health services because it also mandated that syringe service programs not be within like I think it was 5,000 feet of educational or religious properties, and we have syringe service programs that are in church
In
basement.
church basements,
Uh,
right? Yeah,
they
yeah,
would they would
yeah.
have been required to engrave every single syringe that they get with their program information. And then it also, one of the other big problems with that was that it would have prevented people with criminal records from working at syringe service programs. And we know
Mm, mm,
uh, that peer support and sharing of lived experience is one of the greatest success factors for, uh, and when I say success, I say that very loosely, but one of the determining factors of, a therapeutic relationship and people making
Yeah.
positive change in their life is if they have strong relationships with people. And unfortunately, drug use has been criminalized for a very long time. So people who use drugs or have a history of drug use are going to be more likely to have a criminal record. And if they can't work at an SSP, they're not going to be able to share that experience with people who are coming in looking for hope.
Let's keep track of this same poor unfortunate person in our example. I'll call this person Danny, male, female, however. So Danny does get arrested and is spending time, let's say, in jail. We can go up from there and talk about maybe state lockup as well. And Danny is has a physical dependence and an addiction, so otherwise beyond physical, to opioids. What does the law say now in North Carolina about making sure that these people are given treatment as opposed to cold turkey?
Nothing. There's nothing except for some US DOJ guidance that says that, if I'm going into a facility and I'm on like buprenorphine or methadone for treatment of my opioid use disorder, the jails are supposed to continue that medication and continue giving it to me. However, um, that's not always happening. There's a lot of nuance there. This is something that the state is actually having a lot of conversations about right now is how can we increase access to these medications and substance use treatment in our carceral system and in diversion programs and deflection programs and stuff like that. But unfortunately, there are still a lot of areas in the state where if I go into the jail and I'm withdrawing off of opioids or other drugs, uh my only the only thing I'm gonna get is maybe some Tylenol and some Imodium if I'm lucky. Um, and that's just so problematic, especially as I mentioned, because the overdose rate is so high among people leaving state prisons,
Mhm.
that we know that that can be extremely problematic. So, unfortunately, in North Carolina, right now, as it stands, there's no laws that I am aware of that require jails to continue or provide medications for withdrawal symptoms.
And if they're in a state penitentiary for
Oh,
multiple
you're on
years,
mute, or I can't hear you.
um, yeah, I haven't
Oh,
changed anything.
weird. You got really quiet.
Can you hear me now? I'm going to hit pause.
Barely. Maybe it's on mine.
Just going to try to pause. Now I don't see the pause button. Oh, here it is. Okay, yeah, we had a little technical problem. Thanks for hanging in there. We should be good to go. I was going to ask, I think you were describing the protocols in North Carolina jails. How about in the state penitentiary? I'm thinking about someone who not only is just sent there, but if they're going to be there for year after year, are there buprenorphine type programs that are available to these folks?
So there are now. I would have to go back and look. I can't remember off the top of my head how many facilities there are in North Carolina that are providing medications for opioid use disorder. It's a relatively small number as of now. However, I know from just everyday work with folks in the justice system that are working with adult corrections, that they are working every day to try to expand that. Unfortunately, there is a worker shortage, not just in general everywhere.
Right.
But adult corrections has really taken a big hit, and they're just so short staffed right now that there's been a lot of challenges kind of implementing those programs into all of the prisons, especially with how many people that are currently incarcerated.
Mm.
But I will say that they've done a great job of expanding over the past several years. I was on a call 2 weeks ago and they were talking about the expansion of the mental health services that they were providing in the jails and substance use services. And I was just honestly blown away at how far they have come over the past 3 or 4 years. It's expanded a lot. Fortunately, there are some services available. Unfortunately, not in all the prisons yet.
Okay, thank you. Let's back up to Danny again here. And how about if they're going to a harm reduction facility? What about testing? Testing for drugs in the drugs that I intend to use. Where is the law on that? I'm particularly curious about if someone does have testing equipment, a harm reduction facility of some kind. I still have to get my drugs there and out of there, and wonder what the kind of barriers I might face or Danny might face in this case.
Danny is having some they are having some challenges.
Yeah,
So test strips are testing supplies are legal in North Carolina through a law that's separate from the SSP law. Um,
the
that
syringe
being
law.
Yeah, from the syringe law. That being said, as you mentioned, possession of drugs is still illegal. So transporting them is where things get tricky. You know, when I was working at a syringe service program, we provided test strips to folks, and we would encourage them to take the test strips to where they were going to be using
Mhm.
rather than bringing the drugs to where the test strips are, if that makes sense.
And this was
Uh,
testing for fentanyl specifically.
Fentanyl, xylazine. Now we're seeing things like medetomidine, which is a newer contaminant in the drug supply. Um, so we would give folks test strips and encourage them to test everything that they did all the time. You know, even if they knew that it was fentanyl, do it to test it just to be sure and just so you know what you're doing. There's, also the problem with contaminated things like stimulants. So for people who don't use opiates, if they get some cocaine or some methamphetamine and it has fentanyl in it, there's a very high chance that they could overdose if they don't have a tolerance to opioids. So encouraging them to also use those test strips is really important. North Carolina is very fortunate because we have probably the best drug checking program in the entire country, right there at UNC Chapel Hill. The folks at the Street Drug Analysis Lab are really doing amazing things. So you can uh, collect samples and send them into the lab, and then they use GCMS to test the drugs and can tell you exactly what's in it, what cutting agents and everything. And the team over there is just doing really amazing work. They get samples from all over the country, and you can, if you're interested in knowing what's in the drug supply, you can go online to their website and look at the samples if you're interested in the ones from Durham or Chapel Hill or Raleigh or Greensboro, wherever you're at. They post what the findings were in different samples that they've collected, and that's actually a legal process. You know, even though you're mailing in this sample or taking the sample to them, when you put the drugs in the vial, it deteriorates them into a solution that can no longer be used and is no longer considered like a controlled substance.
And so this isn't for Danny to find one of these tubes and send in. This is if Danny makes it to a harm reduction facility that has a connection with this organization, then it can be sent in. Yes?
Yes, yeah,
And it's not for
absolutely.
dealers at this point anyway. Although we've talked about it, it's not being used as we know by, as far as we know, by dealers who want to make sure it's clean or perhaps want to advertise the high potency of fentanyl. Any thoughts on that side of things?
Can't confirm or deny if drug sellers are doing that, but another really great mechanism for drug checking is like an FTIR based machine. So programs in Greensboro, like North Carolina Survivors Union, are doing some really amazing FTIR work, and are actually working with people who sell drugs to make sure that what they're getting and then getting rid of is what they say it is, because I think there's a big misconception that drug users or drug sellers just want to like hurt people, and that they're going to do anything and everything possible to make every dollar they can, and that they don't care about anybody, and all these things that we've heard for a very long time, and that's just not the truth. I've seen so many people um, get their drugs tested that maybe they were selling or doing, and find out that it had something in it that they weren't very happy about or very pleased about and didn't want, and would get rid of it, and no longer sell that supply, or no longer use that supply. So programs like this are really, really important to saving lives.
So there's still the big barrier is how do you get somewhere without potentially putting yourself at legal risk to get things tested? Yeah,
Yep,
yeah, okay.
absolutely.
And uh, how about stricter penalties for fentanyl possession? Where are we with that with North Carolina law?
Yeah, we've seen some changes, lots of changes in what fentanyl is classified as. There's been over the past several years big pushes at both state and federal level for it to be classified as a weapon of mass destruction. I know at the federal level that happened. I can't remember, just being totally honest, if that did happen. If it passed in North Carolina, I don't think it did, but it may have at some point over the last year. But again, that's just something that's extremely problematic in my eyes. I'm saying this part, not as an individual, and not necessarily reflective of NCDHHS, because all that does is it just builds stigma. It creates an atmosphere of if I see somebody overdosing and they're not breathing, and I hear that fentanyl is a weapon of mass destruction, I'm going to be scared to render aid. I'm going to be scared to give them CPR. I'm going to be scared to touch them, because I'm worried that I'm going to overdose by touching the fentanyl, and that's just a really common myth. It's literally physically impossible to overdose by touching illicitly manufactured fentanyl. But again, it's stigma, and one of the things I talk about most often is stigma, and I'm a true believer that stigma associated with drug use is far more dangerous than the drugs themselves.
Hmm, hmm. All the social repercussions, for example.
Yes,
That's
yes,
very
because
damaging. People can't get their, I think about Danny, which she finally does get out of her out of being locked up, does his or her time, does their time, and that stays with them. Is it still for life? If it's if that crime will stay on your record for life, it doesn't ever get washed out.
unfortunately, and I'll be totally transparent. I'm somebody who has been convicted of a felony in the past, and to this day, what it was 13 years ago, 14 years ago, it still haunts me. I still have to, anytime I apply for a job, check that box. And then I have to provide verification on why they need to hire me, and what explain the whole traumatic story all over again every single time. Me and my wife bought a house a couple years ago, after selling a house, and when we were in a period of time where we thought we were going to have to rent a house, or rent an apartment for a little bit until we were able to get into the new house, and had to do countless applications, and every single time was denied because of that criminal record, that felony conviction from years ago. Despite having a history, having shown that I am a productive member of society and somebody that is responsible and can do the things that I need to do.
Yeah, yeah, I'm sorry that happened. I was speaking to a good friend of mine who had a similar situation to yours, and I innocently asked him about applying for some kind of job I thought he would just be great at because he's great at everything he does. And he went, I won't get past the screening because of that felony from 20 plus years ago. And some people don't know that there are a lot of more progressive, or at least in this way, countries where when you do your time, that's the whole idea. You do your time and then you're done. You're
Yep,
literally done. You're voting again. You're purchasing a firearm if it's legal in that country, period.
yep,
And you're getting jobs without having to check that box. You know, you may have to still talk about this time when you weren't employed, but that's on you. You're not punished for life, which is a very interesting
absolutely.
phenomenon here. Punished for life. Yeah, thank you. A couple other ones. I'll try to move a little bit quick here. Um, Anything about cannabis regulation that's still being talked about down in Raleigh? Hemp cannabis.
I'm gonna say this off the record. I don't know if they
Whoa,
should.
whoa, whoa! Off the record, what? You mean not in your official capacity?
Yeah,
Because
it
if
can't
you
be.
say it now, it's on the record, like literally. Just
Okay, all right. It's
yeah.
so yes. There's been a lot of different policies related to cannabis and um, other, I guess, products that are sold in North Carolina under different names, like kava, kratom, tianeptine. There's all these different things that are kind of intertwined. Vaping is another one. So there's definitely been a lot of focus on those things, especially as it relates to adolescent use, because
Mhm.
we know that the earlier you start using substances, the more likely you are to have challenges. There's been a lot of focus on regulation of smoke shops. So we know that, cannabis is through the Farm Act and hemp bills. Hemp is legal in North Carolina up to a certain percentage of THC.
Mhm.
However, there are ways that that has kind of been bypassed essentially with as science has evolved, we found different ways to derive different products from the cannabis plant, and they're being sold perfectly legally, um, just kind of as loopholes. So that I think we're going to continue to see an evolution of cannabis related policy in North Carolina. I know that I believe the governor's office recently created or announced a cannabis task force that was going to not necessarily be, I don't say task force in the sense of like going after people for cannabis,
No.
but to research and look at cannabis at both the benefits and the harms that can be associated with it. So I'm really interested to kind of see how that goes and what the outcomes of that are.
Yeah, yeah, me too. Um, so we've talked about drug policy. We should probably include the drug potential drug of gambling, online gambling, legalized. And you and I both, I'm sure, have friends that are working for the state around that particular issue because the hotlines, the gambling hotlines, like the trend is, about a 45-degree angle.
Yep.
Um, so is I wonder if there's starting to be talk down in Raleigh about reforming what seemed to be an open checkbook around online gambling, particularly for our youth. Do you happen to know?
I'm not real sure. What I do know is that our division of mental health, substance use services, Developmental Disabilities Substance Use Services, has been talking about also like, you know, expanding our name and also including problem gambling because we know that that's another issue that's really impacting North Carolinians. I know tons of friends that over the past several years since it was legalized have faced challenges with it, and I see it impacting people the same way that substances do.
Yeah, yeah, yeah. Interesting. Keep an eye on that. Um, there's always more, and I want to be respectful of the students' time and certainly your time. Is there one other that you wanted to be sure you squeezed in?
Um, yeah, I think one thing that I've seen um over the past year, 2 years, especially after Hurricane Helene, um, is around opioid use disorder treatment and the expansion of things like methadone clinics. So, opioid treatment programs. One of the things that I've seen really happen is an expansion and changes in rules around mobile units and mobile methadone in North Carolina. So we're now starting to see some mobile units, buses for the clinics where they're able to go out into rural areas that maybe weren't being reached before. Um, and this was something that really was the result of I mean, lots of years of thinking and brainstorming, but I think Hurricane Helene, if I had to take a guess, would be one of the driving factors that kind of led to this big increase in mobile units that we're seeing. So I'm really hopeful for that. Hopeful that over the next couple years, one of the goals of DHHS is methadone and MOUD saturation. So we're hoping to increase access to buprenorphine and methadone to all 100 counties.
Boy, that's a great way to end this too. That's really positive movement. That changes the landscape pretty significantly. Because we
Yeah.
have a funny way of punishing people through treatment too. Like you have to come every day, you have to be in line by 7 o'clock, you have to be in a long line, sometimes out in the weather. And yeah, I understand that you have childcare and we're also being asked to find a job that has this level of flexibility. But this idea of going to these folks, that'd be a game changer, seems to me.
Yeah, the current or the we've evolved, but I will say that the methadone system or the OTP system, the opioid treatment program system has really looked a lot like the carceral system and the jail or prison system
Yeah,
for a long
yeah.
time because you have to be there at a certain time. They tell you what you can and cannot wear. They tell you what you have, like every second that you're there, you have security over you. There's cameras, there's guards. Like it really mimics the carceral
Hmm.
system. And my supervisor does a really awesome presentation called "Not Your Parents" OTP. You can go on the Opioid Prescription Drug Abuse Advisory Committee website and look at I believe it was the June 2025 presentation. I'll find it and send you the link
Okay,
just
please
to
do.
make
Yeah, I'll share
sure.
that with the students. Yeah,
But she did a presentation called "Not Your Parents' OTP," and it
nice.
compares the carceral system to the OTP system, and it was just so eye-opening to me.
Oh, I'd love to see that. Yeah, yeah, yeah. Send it my way. Great way to end, Tyler. Thanks again. I like you so much as a human being, and I certainly am glad that you are down in Raleigh, representing all of us down there for a better community. So, thank you so very much.
Thank you.
Any words to the students before I click the record button?
I just want to say thank you for having me. This has been a great conversation, and I'll share my contact information. And if folks have questions or want to follow up with me and send me an email, they're more than welcome to do so.
I'll make sure to include that then. Well, let me hit the
Cool.
record button, then say goodbye to you.